Good afternoon, guys. Now, today's discussion we are discussing most American most Americans don't know how to prevent dementia, and that is a public health failure we can fix. Okay, so I'm going to do the go through the presentation I made for you. Sit back and enjoy, please. Okay, last winter I sat with a woman named Margaret as she tried to remember her grandson's name. She was 82. She was 82, a retired teacher, the kind of person who used to keep entire classrooms of children straight without a single note. But on that afternoon, she stared at me with panic, raising her eyes as if her own mind were slipping through her fingers. Her daughter told me later, we didn't know there was anything. We didn't know there was anything we could have done. That sentence, quiet, resigned, devastating, is repeated in families across America every day, and it reveals a truth we can no longer ignore. Most Americans don't know how to prevent dementia, even though of medical conditions, a large portion of dementia risk is shaped by treatable medical conditions, everyday behaviors, and structural factors we can change. This is not a personal failure, it is a public health failure. Fatalism is the enemy, and it's everywhere. For decades, dementia has been framed as something that just happens if you live long enough. That fatalism has been profoundly damaging. It has discouraged prevention, delayed diagnosis, and convinced millions of Americans that decline is inevitable, unavoidable. But the science is clear. Up to 40 to 45% of dementia cases may be preventable or delayable. Dementia is not a single disease. It is a cumulative result of vascular injury, metabolic dysfunction, sensory loss, inflammation, and cognitive understimulation. We have the tools, we simply aren't using them. The most powerful interventions are the ones we ignore. Margaret's story is not unique. She lived with untreated hearing loss for years. Her blood pressure crept higher each decade. She stopped walking regularly after a fall. None of these were framed as cognitive risks. No one told her daughter that hearing loss is one of the strongest modifiable dementia risk factors. No one explained that keeping some systolic blood pressure under 130 is one of the most effective ways to protect the aging brain. These are not obscure facts. They are well established science. Yet hearing aids remain stigmatized and expensive. Hypertension remains undertreated. Exercise programs for older adults are scarce. Diabetes management is inconsistent. Vision care is soloed. Air pollution is diminished. Dismissed as an environmental issue, not a cognitive one. We have allowed dementia prevention to become a matter of luck. Who happens to have a clinician with time, who can afford hearing aids, who lives in a walkable neighborhood, who breathes clean air, cleaner air. That is not prevention, that is inequity. Why don't Americans know any of this? Because our system is not built to tell them. Because our system is not built to tell them. Primary care visits are too short for prevention counseling. Hearing and vision care are treated as optional add ons rather than essential brain health. Public health messaging is inconsistent and drawn out by fad-driven brain health noise. Dementia remains stigmatized, making conversations uncomfortable. Many risk factors are visible until damage accumulates. Prevention is rarely reimbursed, rarely incentivized, and rarely prioritized. We allowed dementia to become a personal tragedy instead instead of a preventable one, preventable public health challenge. It is a policy failure and a policy opportunity. If we want to protect families like Margaret's, we need more than awareness. We need action. Insurance coverage for hearing aids without loopholes or delays. Aggressive blood pressure control programs in primary care. Community-based exercise incentives for older adults. Routine vision screening and affordable contact care. Cataract care. Air quality standards that recognize cognitive health as a measurable outcome. Public messaging that is clear, evidence based, and impossible to ignore. These are not luxuries, they are the minimum required to protect the cognitive future of an aging nation. The hope we rarely name. The most hopeful truth is this: the brain is resilient. It responds to care, it responds to protection, it responds to change. Margaret's daughter told me, I wish we had known. We could, we can build a country where families do know, where prevention is accessible, where risk factors are treated early, where cognitive decline is not accepted as fate. Most Americans don't know how to prevent dementia, but they can learn and they can act. And policymakers can make it possible for everyone, not just the privileged few, to protect the future versions of themselves who still want to remember, connect, create, and live fully. Okay, here's the second half of B, guys. A narrative on dementia. The walk on a warm July morning in Meadville. A woman named Ellen steps onto the sidewalk outside her home. She is 72, recently retired, and newly aware of the subtle ways her memory has begun to fray. Names take longer to surface. She sometimes loses her train of thought mid sentence. Her doctor reassures her that this is normal aging, but she feels the quiet fear that so many older adults carry. Is this the beginning? She walks away past the post office, past the bakery, past the small park, where children climb the jungle gym. Her place, her pace is slow but steady. She doesn't know that this walk, this simple, ordinary act, is one of the most powerful things she can do for her brain. She doesn't know that movement increases blood flow to the hippocampus, strengthens neural networks, and reduces dementia risk. She only knows that walking makes her feel more like herself. Her story is not separate from the science. It is the science. Across town, a primary care clinic hums with the usual weekday rhythm. A nurse calls in the next patient. A man in his late 60s named Robert. He has come to a routine checkup, but today the nurse adds something new, a hearing screening. He hesitates. He noticed he's been asked he's been asking people to repeat themselves more often, but he chalked it up to background noise or numbing or mumbling. The screening shows mild hearing loss. The nurse explains that untreated hearing impairment increases dementia risk, not because hearing loss causes memory loss directly, but because it isolates people, increases cognitive load, and changes brain structure over time. She tells him that early use of hearing aids can help prevent cognitive function, help preserve cognitive function. Robert is surprised. He had never heard this before. Hearing loss, he thought, was an inconvenience, not a risk factor. This moment, the small preventative act, is a hinge point in his cognitive future, but it only happens because the clinic decided to integrate hearing care into routine visits. It is a reminder that dementia prevention is not only personal, it's structural. The grocery store. A few miles away, a mother shops for groceries with her teenage daughter, their cart filled with familiar items, boxed dinners, frozen meals, inexpensive snacks. They live in a neighborhood where fresh produce is limited and expensive. The nearest full grocery store is a bus ride away, and the bus schedule is unreliable. The daughter picks up a container of blueberries, $5.99 for a handful. They put it back. Nutrition research tells us that diets rich in vegetables, whole grains, legumes, and healthy fats reduce dementia risk. But research also tells us that access determines behavior. When healthy food is scarce or unaffordable, cognitive outcomes cognitive outcomes decades later are shaped long before symptoms appear. The mother is not failing, the system is. The science, these stories, Ellen's walk, Robert's hearing test, the mother's grocery aisle, braid together into a larger truth. Dementia risk is not fixed. It is shaped by vascular health, sensory protection, metabolic stability, sleep, social connection, and injury prevention. It is shaped by neighborhoods, clinics, transportation systems, food access, and social infrastructure. The Lancet Commission estimates that up to 40 to 45% of dementia cases may be preventable or delayable through risk factor modification. That number is not a promise, it's a call to action. But the action required is not only individual, it is civic. The neighborhood. Back to her walk, Ellen pauses at a crosswalk where the paint has faded and cars rush by. She waits longer than she should. She feels vulnerable. She wonders. She wonders whether she should turn back. This moment is a public health issue. Walkability is not a luxury. It is a cognitive health intervention. Safe walking, safe sidewalks, protected crosswalks, green spaces, and mixed use zoning increases physical activity, reduces isolation, and supports aging in place. A neighborhood that supports walking supports brain health. A neighborhood that discourages walking increases dementia risk. The built environment is a form of prevention. The silence. There is a silence around dementia that harms us. We whisper about it. We treat it as fate. We assume that nothing can be done. This silence prevents action, personal, clinical, and political. But the truth is louder. Dementia risk reduction is possible. It is meaningful. It is urgent. And it is collective. The call. Imagine a community where hearing screenings are routine, where fresh food is accessible, where sidewalks are safe, where blood pressure checks are treated as cognitive protection, where social programs reduce isolation, where older adults are supported rather than sidelined. Imagine a health system that integrates dementia prevention into every chronic disease pathway. Imagine policymakers who treat brain health as infrastructure. Imagine a culture that sees aging not as decline but as a stage worth investing in. This is not fantasy. It is design. The return. Ellen finishes her walk. She feels steadier. She feels connected to her town, her body, her future. She does not know that her walk is part of a larger movement, one that includes Roberts. Hearing test. The mother's grocery aisle and the nurse's quiet advocacy. She does not, and the nurse's quiet advocacy. She does not know that her walk is an act of resistance against cognitive decline. But she knows she will walk again tomorrow. The braid. The braided narrative is not a single story. It is many stories woven together to reveal a deeper truth. The truth here is simple. Dementia prevention is not a private burden, it's a public responsibility. We reduce dementia risk not only through personal habits, but through collective choices, policy choices, design choices, funding choices, cultural choices. The future of brain health will be shaped by what we build, what we prioritize, and what we and how we care for one another. Okay, guys, that is your B. Be back on with C shortly. When I figure out what that is, I will be back on with that for you. For now, Gator Wellness. Take care, folks.